This is Jennifer Cook, and this is the AED skill set video. So when you come upon a victim where there's no signs of life and they are unconscious, you start CPR as instructed in the previous video. Be sure your gloves are on as always, proper protocol. And you continue CPR until an AED or EMT arrives. If the AED arrives, you cut away any clothing. You make sure that the patient is not on a wet surface or a metal surface. If the patient's chest is wet, you wipe them down. You make sure there's no cell phones within 6 feet of you or the AED. The very first thing I should have said, the first thing you do when the AED arrives is you turn it on. That's the very first thing before you cut away clothing and wipe down the patient or anything like that. So the second thing, for an adult, you get the adult pads and you place one like this way on the top right of the chest. The second one goes under the left side of the nipple and under the arm with the wires pointing towards the midline of the body. At that point, once the pads are on, you say clear before you plug the connector into the AED. Be sure you say it in a loud voice so that no one is touching the patient when you plug the connectors to the AED. When that's done, you say analyzing clear again. You push the analyzing button and the AED will prompt you to either not shock, and then at that point you would continue chest compressions and CPR. If it does say shock, say shocking clear to be sure no one is touching the patient. And then you shock and continue to follow the prompts of the AED, depending if it wants you to shock again or continue with CPR and chest compressions. The difference with a child or an infant is that you would use pediatric pads for 8 years under the age of 8 or under 55 pounds. And if the child, you would place the pads in the same way unless the child is an infant. And if they are small and the pads would be touching when you place them at the top right chest and under the left nipple, then you place one in the center of the chest and then one at the mid part of the infant's back, and then follow the other procedures just as normal.